If mental health is just as important as physical health, why isn't it always treated that way? Hey guys, if you're new here, my name is Jessica. Today we're going to talk about a major US mental health policy called the Mental Health, Parity, and Addiction Equity Act. Before we get into this policy, it's important to understand why this is a big issue. Mental health, as we all know, has not always been treated equally compared to physical health. I mean, imagine if physical health problems were treated the same way that mental health problems were.
Hey, what's wrong? My chest really hurts. I think I'm gonna have a heart attack.
You look fine. Stop overreacting.
Hi, I would like to book an appointment for physical therapy. I broke my arm last week.
Let me check. Oh, I'm sorry. Your insurance does not cover that. But don't worry, you could try some breathing exercises. I'm sure it'll heal on its own.
What? But my arm's broken.
Everyone gets a little broken sometimes. You just gotta power through it.
So about that, did you want to go check it out and see? Yeah, that cheeseburger place sounded really good. Yeah, that ice cream shop sounded pretty good, but dude, you keep bumping into things. Are you okay? Maybe you should get your eyes checked. Yeah, I just need to focus harder.
This gap didn't happen overnight. For decades, many people didn't see how often mental needs were often ignored, misunderstood, or covered in ways that weren't fair. Overall, people did not realize how this affected everyday life. Before there were psychiatric or mental hospitals, most people with mental illnesses were cared for by their families. But in severe situations, the National Library of Medicine reported that people with severe mental health conditions were placed in jails or almshouses. Back then, there was no understanding of mental disorders or how to treat them. The solution at the time was either to punish them or to simply hide them away from the public. Over time, families and communities struggled to care for people with severe mental health conditions. And the solution to this was mental health hospitals. The first mental health hospital goes all the way back to the 18th century. And by the end of the century, nearly every state had some sort of mental hospital. Unfortunately, the conditions of these hospitals were often awful around this time. For example, at the Pennsylvania hospital, mentally ill patients were kept in the basement rooms with shackles. Even the names of the hospitals reflected the attitude toward mental health of the time. Mental health conditions were referred to as insane or lunatic. One hospital in Philadelphia in the 1800s was called the Asylum for the Relief of Persons Deprived of the Use of Their Reason. But today it exists as Friends Hospital. There were over 500,000 patients in these hospitals by the mid-1900s. Mental hospitals were overcrowded and understaffed. Patients at these hospitals were often neglected, had no privacy, and they were abused. Even though these hospitals existed back then, mentally ill patients still didn't get the treatment that they deserved. The deinstitutionalization movement was a major occurrence in the United States. Although the intent behind this was to reduce psychiatric hospitals and shifting individuals to move toward community-based services, the result led to more barriers for individuals with mental illness. A study by Montenegro and colleagues in 2023 found that the failed transition to deinstitutionalization was from lack of funding, inadequate planning, and limited knowledge. According to the National Alliance on Mental Illness, or NAMI, The first federal mental health parity law was established in 1996 called the Mental Health Parity Act. This was a stepping stone for mental health getting equal treatment to physical health care. But there were some gaps and limitations to this, specifically the dollar and lifetime dollar limits. Many individuals were affected by this. A research study in 2003 by Berry and colleagues found that 74% of employees who had mental health benefits in their health plan were limited to an annual outpatient visit. 64% had an inpatient day limit. 22% had higher costs for mental health benefits compared to general medical benefits. These findings essentially exposed a huge disparity in mental health coverage. These barriers made mental health services harder to access, more expensive, and ultimately less fair. And to make things even worse, a study by Frank and colleagues found that 7% of the plans completely excluded substance use disorder treatment. On top of that, individual insurance plans were more likely to offer no coverage at all for mental health or substance use disorder. And to put this into perspective, around 49 million Americans had no health insurance during this period. While people with coverage faced limits and exclusions, millions had zero access to mental health or substance use treatment from the start.
Mental Health and Addiction Equity Act simply provides equal treatment for diseases of the brain and the body. This legislation provides people in health plans with the same exact coverage that we as members of Congress have.
In 2008, the Mental Health Parity Act was revised as the Mental Health Parity and Addiction Equity Act, which is what we currently refer to as today. This act essentially included substance use treatment as part of equal benefits between mental health and medical benefits. The Mental Health Parity and Addiction Equity Act applies to U.S. employers with more than 50 employees, but this does not include the individual insurance market. To go into it a little further, the health plan services covered only the mentioned mental health conditions and substance use disorders. Okay, so you're probably wondering, yes, so we have this act, but how does the government comply to this? And the answer to that is the 2021 Consolidated Appropriations Act. In this act, it basically states that group health plans that offer both medical, surgical benefits and mental health and substance use benefits must provide non-quantitative treatment limitations, or NTQLs, comparative analysis to show mental health and substance use benefits are equally treated as the medical benefits to federal agencies. NTQLs are basically the non-number restrictions insurance companies use. Things like rules about which providers you can see, which clinics count, how much they'll reimburse, or whether they think your treatment is medically necessary. The U.S. Government Accountability Office and also the Department of Labor, Health and Human and Treasury are required to release annual report to Congress of the Mental Health Parity and Addiction Equity Act. So, what is the latest version of the Mental Health Parity and Addiction Equity Act regulations? On September 9, 2024, the Department of Labor and Health and Human and Treasury released 4 new rules to the Parity Act. Number 1. The law defined what health plans and insurances need to include in their NTQL's comparative analysis and set deadlines when requested by federal agencies to hold them accountable. This information includes the network composition, out-of-network reimbursement rates, and medical management and prior authorization NQTLs. Number 2. The law requires health plans and insurers to actively check whether individuals are facing barriers in accessing mental health or substance use care by collecting and evaluating data. This one is a great one, at least in the way it really pushes health plans and insurers to be accountable for barriers such as denial or network availability. With this regulation, these insurers are literally legally required to address and take action in explaining why an individual is struggling to access mental health and substance use care. Number 3. The law prohibits health plans and insurers from using discriminatory information, evidence, sources, or standards that disfavor access to mental health and substance disorder benefits compared to medical and surgical benefits. Number 4. This regulation ends the exemption of self-funded or non-federal government plans to opt out of the Mental Health Parity and Addiction Equity Act compliance. And now we're moving on to the 2025 update. So, recently the Department of Labor, Health and Human and Treasury released a statement on May 15, 2025 about the new 2024 rules. And although the federal government issued these new rules for the Mental Health Parity and Addiction Equity Act, it's currently not being enforced. The reason being is because a major employee group challenged this rule in the court, and also a recent executive order directed agencies to review these regulations that may create unnecessary burdens. And because of this, the departments decided to reconsider the rule and have paused the enforcement of these new requirements until litigation is resolved. So until we hear another update from the departments, right now there is no new regulations enforced. So overall, even though there were these proposed 2024 regulations for the Mental Health Parity and Addiction Equity Act, right now it's staying as it is, and the older 2013 rules still apply. With the current Mental Health Parity and Addiction Equity Act, there are several gaps that need to be addressed in the United States. The first gap is there is limited client awareness of the rights in this act. Now, a possible solution to this is educational outreach. Maybe this could look like a workshop, some webinars, anything than a long piece of paper that just informs what it is, something that could help these individuals know their rights about the Mental Health Parity and Addiction Equity Act. The second gap is there is a lack of mandate for mental health coverage. To this day, employers are not required to include mental health coverage. Employer insurances are only required to have mental health care coverage equal to physical health coverage if it is offered, but if employers do not offer it, it's because they are not mandated to do so. I guess the easiest solution to this is just making it a requirement in insurances to have mental health coverage. The third gap is there is no penalty for insurances to deny claims or be non-compliant. For this one, I think a solution to this is establishing monetary fines for violations and damages. We have a lot of these individuals who are affected majorly by these denials. Shouldn't these insurance companies not be held accountable too? The fourth gap is the delayed enforcement of the 2024 Mental Health Parity and Addiction Equity Act regulations. As I mentioned before, currently it's being legally challenged by employers and insurance companies. With the turnout of this case being out of the public scope, our only solution is to wait to see if these regulations will be enforced or if they will be replaced or repealed. That's it for today. If you want to dive deeper into the Mental Health Parity and Addiction Equity Act, check out the references and resources I have listed. I will also drop the link in the description below. Until next time, like, subscribe, and share this video to help spread the knowledge. Remember, keep learning, empowering, and advocating. Let's keep building a future where mental health matters.